Hello, future nurses. If you're struggling to remember the types of insulin for your NCLEX, here are easiest way you will remember them in 2 minutes. Okay? Note that insulin is typically used for type 1 diabetes, but type 2 diabetes can also use them if oral diabetic medication is not effective. That's when we'll switch over to insulin. So here we are going to discuss the 4 types of insulin that normally shows up in your exam. They are rapid acting, short acting, intermediate acting, and long acting insulin. Let us start with the rapid acting. Like the name says, rapid acting. Example is Lispro, also known as Humalog, okay, or Novolog. We have Aspart and Glolicin. The onset means when the insulin starts working. The onset is about 5 to 15 minutes. So make sure that your patient, the food is right in front of them before you give it. That's what you're being tested most of the time. Rapid acting insulin peaks in about an hour. Note that the word peaks means when the insulin is working at its strongest. That is also the highest risk for hypoglycemia. The duration, we have to make sure we know the duration. Duration means how long it works in your body. The duration for this one is 2 to 4 hours. Okay? Key word here is that it is a rapid acting insulin and food must be in front of your patient before you give it. The second one is the short acting insulin, also called regular insulin. Please make sure the meal trays are on the floor before you give this one. Okay, that is, it starts working about 30 to 60 minutes and it also peaks between 2 to 4 hours. For the duration is about 5 to 8 hours. This is the only insulin you can give via IV. NCLEX favorite question. Let's switch gear and look at the third one, is intermediate acting insulin, also known as MPH. This one, it starts working about 1 to 2 hours. It peaks about 4 to 12 hours. It lasts long, about 12 to 18 hours. Often given twice daily, morning and night. Then the last one is the long-acting insulin, like the Glargine and Detamir. It starts working about 1 to 2 hours. It has no peak time. It lasts long for about 24 hours. It's a steady basal insulin. The side effects of all insulin is hypoglycemia, means low sugar level. Get our patients to rotate the sides to avoid lipohypertrophy, which means scar tissue which forms around the skin area after injecting insulin on the same spot over and over again. You may also be tested on how to mix insulin. Remember, when mixing regular and MPH, R before the N, regular before the MPH. We have to educate the patient to take extra insulin when they are sick per the doctor's order. Patient education is very, very important. Exercise also is good for diabetic patients, but we must monitor for signs and symptoms of hypoglycemia, which are low sugar. Hypoglycemia means low sugar. Clammy skin, sweaty, they might be confused, and also hungry. On the other hand, hyperglycemia means too much sugar. Patient will feel very nauseous, sluggish, and tired. Thank you so much for watching. My name is Dr. Obe Mbanefo. Please follow Banef Nursing on our YouTube, TikTok, and Facebook. If you like this video, please share with your fellow nursing students and also leave your comments below. Now it's time for pop-up quiz. Are you ready? Drop your answers in the comment section. Thank you.